Hello, and welcome to the Ascend Health Show. I'm Nick Angelis. I'm a nurse anesthetist, and I'm the owner of Ascend Health Center. And today, I have Amy McMillan, physical therapist, with me.
Thank you so much for having me. Excited to be here.
Great. And probably the first issue people want to hear about is, why are there eyeballs on the screen?
So yes, I brought a demonstration. So I'm a vestibular therapist, which means that I basically will treat anything related to dizziness. And when it comes to the vestibular system and the brain and why people are dizzy, I look at eyeballs all day long. So I have these goggles, infrared goggles that I hook up to my computer, and I get to record what people's eyes are doing. This particular case, I figured out that the patient probably had a stroke or something wrong with the brain, so that's what the eyeballs told me, and that's why I brought that here today. And then what I do is make sure I get them the appropriate care that they need.
Sure. And you can hold up the goggles too in case you
I can hold up the goggles.
Because who doesn't want to see goggles?
Yeah. So I am a mobile physical therapist. So basically I bring the clinic to my patients.
Sure.
Because it's not very comfortable to drive while you're dizzy and maybe not very safe. So this, basically, I bring the clinic to patients.
So essentially it's physical therapy, but for something where because they need the physical therapy, they can't really drive to physical therapy.
Yeah, so vestibular therapy, I'm just a specialist in the branch of physical therapy. So I did continuing education and certifications where I specialize in just dizzy disorders.
Okay, that makes sense. So it's a little bit, at Ascend Health Center, we treat migraines, but the challenge is if you're not having a terrible migraine, you shouldn't come to me for help because I'm a nurse anesthetist. Like I will take care of the pain, but just take an Excedrin or get on Amovig or something to that effect. But if you have a really serious migraine, then you can't come to me because you're in bed with a migraine. So that makes sense of why you would just visit patients.
Yes. I started the business 3 years ago, approximately 3 years ago during COVID. And people didn't have access to healthcare. They were very limited on the patients that we were accepting in hospitals.
Right.
And I said, well, these people are suffering from home, and I don't know if you've been dizzy, but you do not want to be dizzy for longer than you have to.
Absolutely.
So I said, well, why not go to them? So this way they're not suffering, and it's kind of blew up in a good way. So we treat vestibular disorders, cover all of Northeast Ohio, but we've expanded to orthopedic conditions.
Okay.
I found that I was getting inquiries and referrals for people who were just too busy to even attend physical therapy. So we cover all of Northeast Ohio and treat vestibular and orthopedic conditions for busy professionals, busy parents, moms, and those who are dizzy who can't drive.
Sure, that makes a lot of sense. Let's start this timer in case we were supposed to do that 10 minutes ago. I don't think it really matters though. We're pretty laid back on this show. And this will be a different show than usual because usually it is a really laid back show where I just talk about whatever comes to mind and you talk about whatever comes to mind. But since we do want to focus on dizziness, I thought we could talk about all 10 common types of dizziness because that's the challenge, especially when you have, I mentioned migraines earlier. I feel that dizziness is in that same category of there's a lot of helpful advice, there's a lot of confusing reasons why people get dizzy, and if you're not careful, you just end up going to multiple specialists.
Yes.
And at the end of that time, you're poor and you're still dizzy.
Correct.
So what we want to talk about is when is it important to be very aggressive in treating the dizziness, and there are other times where, and this sounds unusual for us as health professionals to say, where it's like, you just have to deal with this and it should fade. So I think that's always the hardest thing for patients to realize, when do we need to be aggressive and do all these therapies, and when is it like, well, this is terrible and I can do a lot of things but it won't really get better, so I just need to wait it out.
Yeah, that's a tough call because most reasons for dizziness you can treat. So if it lasts longer than a day, like I'll have a couple sessions where I stand up too quick and I'll feel a little lightheaded, but it doesn't impair my function, I'm not passing out.
Sure.
I'm just going to drink more water and go. But what if you have BPPV, these inner ear crystals where you look up, you spin, maybe it doesn't bother you and it just happens randomly throughout the day. You can do everything you want, but what happens if you look up to look at a tree and you fall backwards So you're at a fall risk.
Right.
So it's just because it doesn't impair you and you can do what you want doesn't mean you shouldn't get it looked at. I think one of the studies that I always go back to is anyone over age 65, I will screen for BPPV or dizziness because it's really prevalent.
Sure.
So just because you can function doesn't mean you shouldn't get it looked at.
Right. And a lot of times it's a differential diagnosis, meaning that there's a lot of things it could be, so let's get to the bottom of it regardless. So I treat a lot of POTS where it's what you just, and I thought this of what you said of, oh, I got up too quickly. Well, that's their entire life. Unless they get up very carefully, they're going to fall over. And we can treat it with IV fluids, and often it's linked to a lot of other disorders like Ehlers-Danlos syndrome. But sometimes that's what you have to do. It may start with dizziness, but then we can progress on. And again, just because someone has a diagnosis doesn't mean it's a lifetime of medications. But at least you have a better sense of, okay, who's the person to see and what's the next best step with this.
Yeah, so and vestibular migraines, do you treat those? So think of, and a lot of people think I couldn't possibly have migraines because I don't have a headache. But just replace the word vertigo, basically spinning, with headache. And I see a lot of those cases.
Sure.
So,
and again, for our viewers, this is what we're doing today. We've never met each other. We're trying to figure out how we can use each other as referral partners with you watching, because this is a lot more fun than doing it any other way. So yes, we can use ketamine infusions for vestibular migraines. Ketamine being, it's known almost as a psychedelic, where it reprograms the way that your brain is processing. So it's very useful for fibromyalgia. We're primarily a psychiatric practice, so anxiety and depression. And it's never a first line attempt at something. If someone has a migraine, I send them across the street to Akron Neurology, and then if they send them back to me, then we'll start working on it. So it's the same with dizziness, where you want to start, of course, with what's the least amount of intervention that I need to do and see if that works. But as you said, it's a serious problem. If you can't drive, if you can't walk, it's not something you can wait around for it to
taking
get better.
days off of work, can't get out of bed, terrified that it's going to happen again. So it's very traumatizing. So that's another portion for collaboration is the CBT, the cognitive behavioral therapy, because a lot of my clients are traumatized by the event that happened to them. So we have to kind of build up that confidence and getting reintegrated back into things that may scare them or back into society. So that's where firm believer in counseling as well.
Right. And I think too, our American mindset is like, okay, let's do something invasive or let's take care of this problem right away. But it's like, well, you can have surgery for this, or you can talk to a therapist about it. So I always tell patients, let's start with lifestyle changes. Let's start with the least invasive and move our way up. And sometimes it is almost like a desperation, like, okay, you've tried 6 or 7 things. We need to try this. And other times it's like, well, you have to do your part too, so we have a better sense of what's going on. It sounds almost mean to say, but I often say, like, unless a patient knows what's going on in their body, we become veterinarians, where like the patient's not talking to us. We have to guess by a bark or a meow almost. So, but we probably should get into the actual 10 reasons before I just talk about everything
Sure. No, we're hitting a lot of them, but no, maybe we can help people kind of figure out when somebody says dizzy. A lot of times I hear from them, my doctor said, here's some meclizine and it happens. I don't believe that at all.
Okay.
So
do you want to define like dizziness? I know it's because go ahead.
Yeah, dizziness can mean a lot of things. Some people have double vision and it makes them unsteady. Some people have just unsteadiness and wobbly in their feet. So I basically will define dizziness with my clients, and that will lead me to a particular diagnosis.
Okay.
So cervicogenic dizziness from the neck is more lightheaded and spacey, and you feel kind of goofy all day. BPPV, the crystals in the ear, it's more 30 to 60 seconds. When your head hits the pillow, you spin. Okay. All day kind of lightheaded, you feel like you're going to pass out. Well, maybe dehydration or POTS. So there are many different descriptions of dizzy, but that helps us to a diagnosis.
Okay. And so there's often interplays with chronic fatigue syndrome then and a lot of other disorders. And so you're probably looking at, okay, well, can we do some therapies that will whatever we end up with a diagnosis, that will shift whatever is going on. Because I think that's difficult for people too sometimes. Like, well, no, this is my official disorder. It's like, well, often it's a constellation of things. So how do we get to the root cause and then treat it?
Absolutely. This way you're not actually fishing around to too many providers. If we could get a root cause, that will help with the plan of care. And then we layer on top of it and say, all right, is vestibular therapy appropriate? We haven't even talked about the treatments yet.
Right.
So yeah, vestibular therapy is, I think the research says 75 to 80% effective change when you do vestibular therapy. So wow, how's that for conservative treatment?
Right.
No pills, no medications, and you're going to find a therapeutic effect in 75 to 80% of cases. That's amazing.
Okay. So how does that one work, the vestibular therapy?
Vestibular therapy, again, goes back to the diagnosis. And then based on that, there's a group of exercises. It could be called cannulus repositioning, where you put the crystals back in place. Gaze stability, where it's a bunch of like head movement exercises. Seeing the eyeballs on the screen, when you move your head, your eyes move at the same time. That's a whole circuit from the brain to the inner ear. This is probably really boring for your audience. I'm sure they're
Googling it right
now.
Yes,
what's VRT? So there's a ton of gaze stability, head shake kind of eye exercises, balance training, and then habituation. Habituation means desensitizing and getting used to what has bothered you.
Okay.
So that's a bit of cognitive behavioral therapy, a bit playing into my treatment. So we find something that makes them uncomfortable and like baby step exposure until our brain forms a positive relationship and no longer bothers them anymore.
Okay. No, that makes a lot of sense. And you're right, we do a lot of those techniques too in mental health. So, and even with phantom limb pain, there's a lot of nerve disorders where it's the same idea of like, this is what your nervous system is thinking. We need to consciously think differently, and slowly we can change that. And as you've mentioned, it does work a lot better than if we just need to numb the whole nervous system with drugs to convince it. Because that is the problem with pharmaceuticals. They're going to affect every organ. Like a friend of mine said, I have blurry vision. What's happened to me? Am I having a stroke? I was like, well, what have you been taking? And they had a cold, so they were taking Mucinex. And I was like, well, all of these drugs, they do affect your alpha, your beta receptors. So although you're thinking it's just for your nose, everything in your body is changing. And it turned out it was allergies, not a cold anyways.
Okay.
So all those medicines were giving this friend of mine blurry vision. So it's, again, like I don't think they prescribe as much anymore, but the medicines they give for toenail fungus, well, it's going to go everywhere else in your body before it reaches the very small blood flow that goes to your toenails.
Yeah.
So again, if you can do anything with therapy or on your own with your guidance, then that's going to go a lot farther with much fewer side effects.
Yeah, it's a lot easier to figure out if we're not dumping a whole bunch of drugs into the system. So definitely a purpose and a place for them, but it's much easier to figure out if we're not having a ton of side effects from meds.
For sure. And we notice that in regular talk therapy too, that if you're having all these antidepressants on board, it may be a little harder to reach deep and find the trauma and expose it and talk about it as opposed to papering over everything.
Yeah.
So, okay. Well, why don't we talk a little bit more about inner ear problems, because that is one of the leading causes of dizziness. Now, is it just the crystals?
No.
Which will really confuse somebody if they just tuned in now.
The crystals. Yeah, so BPPV is the most common, benign paroxysmal positional vertigo. That's a mouthful. But yes, the vestibular system, it's about the size of a dime. Gosh, it can wreak havoc for being that small. But the crystals, they can kind of go out of place, and then you'll have that quick little spin of vertigo. That's one thing that I see. But there's also the nerve that corresponds to eye movement and brain. Hypofunction is what it's called. So think of like a tug of war game. So you have 5 guys on the left and 5 guys on the right. And if you have a virus or a tumor, what else? Meniere's on one side, it's like having 2 guys on the left side and 5 guys on the right.
Okay.
So the right side is always winning, and it's an imbalance because it's an improper tug of war. So hopefully that can help people figure out what the vestibular system, it needs to be 5 guys on each side to keep everything in line.
And we have seen that sort of thing from viral infections. It wasn't mainstream until COVID, but for years, because I had a background in holistic health as well, whether it's the Epstein-Barr virus or someone being mono, you can see all these strange changes that are not limited to the immune system, but instead go off into the nervous system, cardiac, all of these systems. So that's really neat.
Yeah, and vestibular therapy is super effective. And you had mentioned COVID. COVID was one of those conditions that did attack the inner ear as well, and super effective to do vestibular therapy for long haulers and COVID. So that was something that we also saw during that time.
And then the benign paroxysmal positional vertigo, is that just more when somebody moves out of their chair and they get dizzy?
The biggest things, indicators for me, lay into bed, roll in bed, get out of bed, look up. If you have like an actual spinning sensation, it's around 30 to 60 seconds. When you do any of those 4 things, that likely is BPPV. It's not constant, it's very quick and short-lived. And just word of advice, dentists and hair salons, probably the biggest culprit because they lay people back. And once you're in a flat position, those crystals can just fall out and you don't notice until 2 to 3 days later that, oops, I have vertigo. So just be cautious, and dentists don't like me for that reason. Oh, you just went to the dentist too?
I just went to the dentist.
So call me if anything happens.
I will, absolutely.
Yeah. So, I always recommend that people don't lay completely flat if they have a history of BPPV. This way they don't get it again.
Right. And it could be from surgery too. I worked for a plastic surgeon yesterday, and often we'll lay patients in different positions for surgery or for recovery. And obviously, recovering from surgery, you're going to have so many different feelings, perhaps of vertigo, that you would just assume those from the anesthetics.
Absolutely, absolutely. And there's a link with anesthesia as well with causing. And we don't know if it's the position or anesthesia. I firmly believe it's the position, not anesthesia, that's causing that. But yeah, you're right. Even microblading or getting like facials or massages. So anything where you're laying flat, it can be tricky.
Well, it could be from the actual anesthesia drugs. I love being a devil's advocate, which is usually the direct opposite of medical professionals. But because of the way that our drugs work on myelin sheaths in the brain, and a lot of how they work is unknown, that could certainly be part of the issue.
All right.
Depending on the combination of anesthetics, because in any given surgery, I might give 20 different medications. So you add up all those side effects and effects.
I would love for you to do a paper on that and the incidence of BPPV. That would be amazing.
Certainly.
Yeah.
So then the next one is neurological disorders, which is probably in some cases a bit more of my specialty, since we see a lot of those at Ascend Health Center. And again, those are the root cause, because sometimes, I think I mentioned differential diagnosis earlier, it can simply be that we find out, no, this is not your nervous system. The ketamine didn't help this problem. You need to go see a physical therapist or a chiropractor or do some therapies or something structural, not the nervous system. And it's known for CRPS, I already mentioned EDS. There's a lot of these disorders that have pain, nausea, vertigo. So you probably just see a plethora of different diagnoses, because that is a rather broad spectrum.
It is. It's very broad, but for example, if you have Parkinson's, you can pretty much identify. I had a patient just a few months ago, and he went years without a diagnosis, and I was like, this person has a movement disorder, the shuffling, the little tremors. He said, nah, that's essential tremors from birth. You know, I looked at his eyes, and he had what's called the gaze-evoked nystagmus, meaning it goes this way when you look to the right and goes that way when you look to the left. That's a sign that something is wrong with the brain. Eye tracking, he couldn't track, something wrong with the brain. Coordination, so you put all that together with the tremors and the movement disorder. I sent him to a neurologist, now on medication. Now he can get out of the chair and taking long strides. MS is another one.
Absolutely.
Had a particular gentleman, he was 40 years old. He was suffering from dizziness, and that's his only symptom. He was kicked out of the ER 3 times, just dismissed. Take some meclizine. I took one look at his eyes, and he had a downbeat nystagmus. Oh, that's a red flag. Sent him to a neurologist. He had MS. So there are a plethora of diagnoses that can be helped. And I serve as a case manager in a bit, just making sure that you are headed off to the right professional. So you might not think a physical therapist is the first maybe course of treatment, but you're getting an hour. I spend an hour with my patients, probably more. Yeah, so probably more. So I'm listening, pretty thorough. So if anything, sometimes I'm a case manager to make sure that we are on the right track, not 15 minutes in and out, take this pill and see me in 3 months.
We've seen that with our psychiatric assessments too, because it's meant to be a longer visit, that we can catch a lot of things that in a 7-minute visit with their PCP, they just don't know what's going on. So the next one is dehydration, which is an easy one in that, so I've always been told drink plenty of water, but you also need electrolytes. So sometimes we'll see dizziness where, they've been drinking a lot of water and they don't have any sodium, potassium, magnesium, calcium. And my suggestion for that isn't really Gatorade. There's plenty of supplements you can take of magnesium. You can make your own Gatorade. I think we have a link on our website for that. So it's not necessarily just drink sugar drinks that add a pinch of salt to it.
Now, what are some of the things that you look for when you know somebody is dehydrated and needs maybe infusions? What are you looking for?
So we do IV fluid infusions. I don't think we even advertise it really, because it's more just for our current patients that we know what's going on. Because that is a thing, like especially places like Vegas where people are dehydrated from drinking too much. And IV fluids do wonders for you, but at the same time, being a place that does such treatment-resistant, we have the TMS, the ketamine. We try not to get into the kind of the frou-frou medical treatments. Is probably a better word for that. So a lot of times we will start with, okay, you don't need to just drink water. You need to make sure you're having a lot of electrolytes. So usually that's something where patient education is sufficient. Again, unless they have some disorder related to the dehydration, then we have a few patients that just come in regularly for IV fluids, and that's the end of it. So, and obviously too, in the wintertime, if there's colds, flu going around, sometimes that's just what you need is IV fluids. So.
And then see how you respond.
And I found that for myself, I had pneumonia, not walking pneumonia, straight up pneumonia, but I was like, I know a lot about medicine. I can cure myself. I was taking 9 grams of vitamin C, electrolytes, and I have really good veins. I finally went back to the hospital to work, found an anesthesiologist had to put an IV in me. It took him 10 tries, and I needed like 3 liters of fluid. I was like, oh, I was really, really sick, and I was just committed to like, I can treat this with myself. And the answer was no, I cannot. So I think that's part of it too, is not being stubborn. That's more of me preaching to myself.
See how do it and see how you feel.
So we already talked a little bit about motion sickness. We mentioned migraines already, because we probably only have a few minutes left. Exactly how long we have, I'm not sure, because I didn't hit that timer. But we could talk a little bit about anxiety and stress, which again is a little bit more in my wheelhouse. And you did mention CBT as an option too.
So when it comes to, I don't know if you're familiar with 3PD, so persistent perceptual postural dizziness. So it's an event of vertigo that kind of latches into the brain, those deep centers of the brain, that it just kind of won't let go. And traumatized from your event, the 3PD, what manifests the symptoms in my patients, it's kind of a constant sense of motion or disorientation, ramped up a little bit by visual stimuli like grocery store, casinos, crowds, action television. So a lot of visually busy things produce that motion sick or possibly 3PD. So we use habituation, and it's actually quite common now. Thank gosh people are recognizing that this is a condition. So we use habituation, taking somebody through a physical experience with baby steps until they form a positive relationship. But that's as much as I know. So I would love, a collaboration and a teamwork approach to healing some of these patients with more chronic dizziness.
Well, sometimes we see it more in high-functioning autism, where they're already, often they have pain issues, they're more sensitive to all stimuli. So part of that is the habituation, part of it is them working through it, making sure they have something as simple as wearing a hoodie. It's suddenly you're in a crowded place, you put that hoodie over your head, it blocks off some of the stimulation. and working through, you can use eye movement desensitization for PTSD. So there are ways that you can adapt, similar to you see all those bladder commercials where the person's always looking for the bathroom, and then they say, oh, you can take this pill and not have to worry about that. So it's a balance. What can you change about your environment, and how can we fix this without going too far in one direction or the other?
And it's interesting that you mentioned like the hoodie and blocking out a different sense. With 3PD, I will focus on picking a different sense. I don't know if you've ever used, like I've used sensory vests, weighted vests to help somebody ground better and desensitize other things and just make them feel a little bit more comfortable. So I use a lot of grounding techniques, including...
Yeah, we use a weighted blanket sometimes because the ketamine infusions are actually heightened sensations. So it's sort of the opposite of drugs like Lyrica or Neurontin that sort of numb the nerve endings. Instead, you're creating new connections, which sounds really scary, but the result is a better resilience in the nervous system to stimulate a better ordering of, here's the stimulation, here's what it would normally trigger me about, but here's how my body's going to react instead. And I think the last ones that we want to talk about are all similar, like medications, high blood pressure, heart disease. We're talking about physiological issues that lead to dizziness. So there, it's, do you have atrial fibrillation? Do you need to get off your medications? Are there some ways that we could do similar medications that may not have the same side effects?
Yeah, just talk to your physician. I always screen. Have you had any new medications started? In the past month to 2 weeks of your symptoms starting. I figured out I had a second dose of Fosamax, and it turns out my blood pressure is tanking and I'm passing out. Please talk to your doctor. The patients are like, oh, my doctor said this, and just go through your medications. If you notice that your symptoms started around the time that you introduced a new dose or a new med, talk to your doctor about medications. And sometimes people don't think about it, so it's just education in that regard.
And it's easy now to take your blood pressure at home. Even Apple Watches, there's a lot of different apps you can use to see what's going on. And probably my last word about dizziness would be a little bit like my devil's advocate earlier about sometimes it just fades and you'll be fine, but learn how much you need to focus on it. Like how much is it going to be your job, how much is it going to be the professionals? And this is a mental health side of it sometimes, but as we focus on things, they tend to manifest. I read an article about how chronic pain is a uniquely American thing, which I didn't realize. Like in other countries, it's not saying that anyone's pain or dizziness isn't real, of course. I'm just saying that in our culture, we kind of end up making these things into even more than what they are.
It's very true. Did you ever hear the story about the nail and the construction worker who fell off a roof, and everybody saw a nail? He thought he hit the ground and felt a nail go into his foot. He's screaming. They take him into the ER, and the nail went through his foot. Everybody saw it, and he did know that. Everybody's telling him it happened, but it went right between his web spaces. So his brain created the actual trauma. Kind of goes a little bit onto what you're saying is, yes, if you perseverate and always focus on it, it can manifest. Distraction, yes, it's there, but put it in the background and focus on what you're feeling.
Absolutely. And again, if you're in that situation, you have to think too, was this a 5-minute visit with somebody who said, oh, this is just in your head? Or is this an hour-long consult where they said, actually, here's what's going on? So that's part of the decision-making process too. Did someone do a thorough workup? Because I've seen many patients in anesthesia and in mental health. They're like, are you sure there's nothing more serious wrong? It's like, well, no, we did a thorough workup. Let's deal with this with non-invasive methods. So if people want to contact you, what's the best way?
Best way is probably via email or website inquiry at customcarerehab.com. The phone number is on the website as well, 330-618-5703. I'm on YouTube, Instagram, Facebook, everything but TikTok.
You're not missing much.
So that's the best way. In Ohio, we are a direct access state, meaning you do not need a doctor's script to initiate physical therapy. So I think that's important to know. We do communicate with physicians, no problem, but you do not have to go to a physician to get a script to start therapy.
Great. And for Ascend Health Center, you can go to our website or call us as well. We do take referrals. You can get into a therapy appointment, psychiatry, and we can just go from there. So thanks very much, everybody, for watching the Ascend Health Show.
Thank you.
You are watching WCTV, Wadsworth Community Television.